So good morning everybody and welcome. On behalf of the Faculty of Pain Medicine and the College of Anaesthetists, it's my pleasure to welcome you to this really important occasion. The national launch, as you can see, we've got the Australian Standards for Health Practitioner Pain Management Education. I'm so grateful that you've taken the time to come to this really important event. My name's Sophie Scott. For those of you that I don't know, I was the medical reporter for ABC for quite a few years. I did quite a lot of stories on pain during that time. I'm an ambassador for Pain Australia, and now I work as an adjunct professor at Sydney University in the School of Public Health, working with academics and researchers on being a better communicator and storytelling. Like some other people you'll meet today, I also have a lived experience of pain, mainly migraine and wrist pain. I remember when I was going through the severe right wrist pain, the scans were all clear. There was nothing that showed up on the scans, but I was in so much pain. And it was only when I went to see the multidisciplinary clinic at the pain clinic at Royal North Shore that they finally explained to me what chronic pain really was and what it meant and the difference between that and acute pain. And I realised that everything I'd been doing wasn't going to work and I needed to have a different approach. And look, my experience is not unique, as you'll hear today, and that's why these new standards for health practitioner education are really just so important. They represent a massive leap in how we're going to be able to educate health practitioners of all kinds, from all disciplines, about managing pain and across the different stages of training as well. I want to acknowledge that we're meeting on the lands of the Ngunnawal people. I pay my respects to elders past and present, and also to acknowledge any Indigenous guests joining us today. It's now my great pleasure to welcome Professor Michael Veltman. He's the Dean of the Faculty of Pain Medicine within the Australian New Zealand College of Anaesthetists. He was elected Dean in 2026 after serving as Vice Dean for a while. He's a consultant pain physician at the Sir Charles Gardner Hospital and the Joondalup Health Campus, and he also serves as the Deputy Director of Health Services over there. So give Michael a big warm welcome. Thank you, Michael.
Thank you. Good morning, everyone, and welcome. I shall put that a bit closer so you can hear me. It's a privilege to welcome you to the Parliament House for the national launch of the Australian Standards for Health Practitioner Pain Management Education. I also would like to acknowledge the Ngunnawal people as the traditional custodians of the land on which we're standing, and I would pay my respect to elders past and emerging and present. On behalf of the Faculty of Pain Medicine, I acknowledge the Australian Government for its funding and support and thank the many people who have contributed to this important work, particularly the project team, the Government Advisory Group, the clinicians, educators, consumers, Aboriginal and Torres Strait Island representatives, and the many organisations and individuals who've participated in this consultation. This is a very significant national achievement. Pain is one of Australia's most common, complex and costly health issues. 1 in 5 people suffer from pain, and yet pain management education remains inconsistent amongst professional groups, despite the very real impact that pain has on people's lives and their families and their workplace and communities. This matters because it isn't just a clinical issue. It affects how people live, how much and how frequently they access health services, disability services, whether they end up in aged care or able to stay independent, whether they present to general practitioners in primary care or to emergency departments, and how often they present to those places. So it's a huge factor in the sustainability of healthcare. Our Faculty of Pain Medicine is a national leader in pain medicine education, standards and advocacy, with an important role in supporting better understanding of pain across the health system. These standards are a significant and practical step forward. They set out for the first time a nationally consistent evidence-based framework for what health practitioners should learn about pain across professions and across all levels of education. That matters because people living with pain do not enter the health system through one doorway. They are seen in general practice, in emergency departments, allied health, mental health, aged care, specialist services and community settings. And wherever they're present, they deserve care that is informed, compassionate, culturally safe and evidence-based. At the Faculty of Pain Medicine, we see education as one of the central pillars of change. If we want better care and earlier intervention, more confident clinicians and better outcomes for people living with pain, we need to start with what health professionals are taught. And today is not the end of this work, it is the beginning of the next phase. The standards are the first major deliverable under the broader National Health Strategy for Health Practitioner Pain Management Education. The next phase is implementation. Supporting education providers, regulators, health services and clinicians to use the standards and working with partners across the system to build pain management capability in practical and sustainable ways. These standards make visible a real gap in the current system, the need for education that builds confidence and capability in day-to-day situations. That is why we are progressing towards practical education pathways to help translate these standards into real-world workforce capability. This is the kind of practical reform that can make a significant difference. Better care, closer to home, greater confidence with the health workforce, and a more consistent support for people living with pain. Successful implementation will require collaboration across government, colleges, regulators, education providers, health services, clinicians and the pain sector. We are very pleased to have so many partners and supporters here today. Thank you for coming. On behalf of the Faculty of Pain Medicine, I would like to thank you all for your support in this important national work. And it is now my pleasure to introduce Dr. Noam Winter, who is a specialist pain medicine physician and member of the Faculty of Pain Medicine Board. He has played a leading role in this work and will provide some background to the standards. Please join me in welcoming Dr. Noam Winter.
Thank you, Michael. Ladies and gentlemen, honoured guests. Imagine if every person in Melbourne, over 5 million Australians, suddenly developed a condition tomorrow that prevented many of them from working, caring for their families, sleeping properly and participating fully in society. It would be front page news. It would be treated as a national emergency. Yet for over 5 million Australians, that condition already exists, and it's called chronic pain. Today, around 1 in 5 adult Australians live with chronic pain, and that means that for 5.4 million Australians, they wake up every day with pain that is unremitting, unrelenting, and has persisted for days, weeks, months, years, and sometimes even decades. Chronic pain is not simply a symptom, it is a disease in its own right. We know it predominantly affects women, and we know that the overall rate is higher in our Indigenous population. For 70% of those living with chronic pain, they're unable to work. And this leads to staggering costs to our nation. Over $12 billion in direct healthcare costs alone, and over tens of billions of dollars in lost productivity. But I'm a believer in JFK's adaptation of the old Chinese proverb that within every crisis lies an opportunity. And I'm really buoyed by having the opportunity to speak to you today about something that I hope will change the lives of those 5.4 million people. Today's a really exciting day. When we identify some of the factors that contribute to the negative landscape that patients with chronic pain experience, a lack of education is something that currently comes out. Acute pain is a universal experience. We've all had pain at some point that's gotten better. So it's really hard for us to conceptualise that for a group of people, their pain simply doesn't go away. And it's really hard to break our own preconceptions, and we often attribute their chronicity to other factors. And we know that these ideas are prevalent within healthcare providers, and that contributes to some of the stigma that patients with chronic pain experience. These problems are only magnified by the postcode lottery that is Australia. We are a giant, diverse country, and we know that the likelihood of getting best evidence-based care, especially in the regions, is low, so that up to 80% of patients living with chronic pain don't get to experience best evidence-based care. The key component to improving this is having a better educated workforce. In early 2021, the National Strategic Action Plan for Pain Management was endorsed by all health ministers in an effort to have a more coordinated approach to the delivery of care for patients experiencing pain. Goal 3.1 of the action plan recommended the development of an overarching education strategy to promote evidence-based pain management across all health practitioner disciplines and all levels of education and training. And in 2023, the government funded the development of a national strategy for pain management education. Goal number 1 of that was to develop some national standards. The goal was to produce transdisciplinary standards that built capacity, capability and coherence across the health workforce, allowing us to use a common language and themes and leading to better outcomes for our patients. It's important to realise that the standards are not prescriptive curricula, and I like to think about them as being universal principles that sit above the level of curricula, that unite all disciplines and then allows for the local development of specific curricula to the specific craft group at hand. And that's what we've really been doing over the last 18 months. This is a little graphical illustration of what our methodology was over the last year and a half. And there's probably 2 things that I'd like to highlight. The orange circle between June and October 24 shows our engagement in stakeholder workshops. So we had 10 national in-person and online stakeholder workshops with representation from over 260 individuals. And importantly, we had representation from both First Nation groups and culturally and linguistically diverse groups. In the first 6 months of 2025, the grey circle, we started drafting the standards, and you'll meet some members of the governance advisory group who helped draft them later on today. And through a Delphi process, we were involved in drafting the standards, being that once again we had diverse representation, inclusivity and expert guidance. Pleasingly, the standards were approved by the Faculty of Pain Board in October last year, and they were approved by government this year in February. And today we have the privilege of launching them in the next few minutes. I'll now hand over to Sophie to continue on.
Thank you so much, Noam. We'd now like to, while the Senate bells aren't going, we're going to make the most of having Senator Wendy Askew with us. I'd like to welcome her to the stage. She's the co-chair of the Parliamentary Friends of Pain Management, the Chief Opposition Whip in the Senate, and she represents the great state where I used to live of Tasmania. Come on up. Thank you, Senator Askew.
Thank you very much, and nice to know that you're from Tassie, Sophie. That's very good. Thank you for the opportunity to be here. I just actually was quite reminiscing, just as Dr. Winter made the comment about the launch of the National Strategic Action Plan to Pain Management back in 21. I actually launched that on behalf of Greg Hunt at the time, so I feel like I've come the full circle at the moment, so it's great to see what has actually come from that launch back then. So thank you. It's a pleasure to be here today for this very important launch. I would like to acknowledge my parliamentary colleagues who I think will come through as the course of the morning goes on. I also extend my thanks to President Dr. Tanya Salak. I'm just not sure where she is. I think she wasn't able to join us. Oh, okay, so that explains it. Okay, that was the instructions I had. So I'd like to also add my congratulations to the Faculty of Pain Medicine and the Australian and New Zealand College of Anaesthetists for their outstanding work. I've had a chance to sort of understand what's been included in this and the work that's been put in place, and it's fantastic. So as you've heard, and you will hear more as the morning goes on, this has been a long journey, but these standards mark a significant milestone as they represent the first nationally consistent evidence-based framework, as we've heard, to address pain management in Australia. Today's launch is the culmination of years of research, collaboration and development. And now, most importantly, it will be implementation. This work will make a real difference to the millions of Australians living with chronic pain. And it's for those people that we are all here. Chronic pain is complex. There is no simple or linear pathway to care, but what these standards offer is clarity. They provide health practitioners with the tools to better understand their patients' experiences and to build a roadmap for consistent, high-quality care. They ensure that pain is recognised appropriately, and just as importantly, they create a shared language between patients and health professionals, one that improves communication and enables more effective management of pain, regardless of its cause. I commend everyone involved in developing these standards. It's an extraordinary achievement, and it is something we should all be very proud of. These standards will support health professionals with the education they need, helping them to deepen their understanding of pain and how best to support those living with it. They place people at the centre of care, grounded in evidence and underpinned by respect, empathy and self-awareness. We cannot underestimate the value of good communication. Anyone who has experienced pain knows how difficult it can be to describe what you are actually feeling. These standards will help change that. They equip patients and their caregivers with a common language, ensuring that pain can be understood, assessed and managed more effectively. Effective pain management is critical to quality of life. So as co-chair of the Parliamentary Friends of Pain Management, I have heard firsthand just how profoundly chronic pain can affect those living with complex conditions. So very pleased that these standards will provide a practical and compassionate toolkit to ensure pain is managed appropriately and with dignity. So once again, I'm very pleased to be here today to support your launch, and I note that the Assistant Minister for Health is in the room, so hi Beck, I didn't see you down there earlier. So thank you very much for coming along today. I hope everything goes really well. I will have to depart back to the Senate shortly, but really am so excited to see the culmination of so much good work. So thank you very much.
Thank you. Thank you so much, Senator Askew. And a lot of what you said we're going to be expanding on when we do our panel discussion to talk about the issues like communication, like collaboration and clarity that these standards are really going to encourage. So I'm now delighted to welcome the Honourable Rebecca White MP to the stage. She's the Assistant Minister for Health and Aged Care, the Assistant Minister for Women and Indigenous Health. And we're delighted to have her support for this very important launch. Thank you.
Yes, we are taking over Tasmanians. Thank you, Sophie. Thank you, Wendy, as well. And I'm sorry that I'm a little late in joining you, so I missed some of the earlier contributions. But I just want to begin by acknowledging the Ngunnawal and Ngambri people on whose land we are gathering today. Pay my deep respects to elders past and present. And welcome all of you for coming into your Parliament House. And congratulations on the work that you have put into today's launch event of the standards. I'm sorry that I didn't get to hear earlier some of the remarks that were shared by those who are much closer to this work than I am. But I am pleased to see so many parliamentary colleagues who are joining with us, because it's really important for us to properly understand the impact that you've made through these standards that we can then reflect in policy decisions. So I'd also like to thank the College of Anaesthetists for their hard work. It's a big job to support somebody living with pain, to listen carefully, and Wendy, you spoke about the fact that often it's hard to describe. It can be hard to properly understand, and unless you're the person living in that pain, it can be really difficult for other people to know what you're going through. So having standards like this is really, really meaningful and could be profoundly life-changing for people living with pain. Because as anyone with chronic pain can tell you, it doesn't just hurt. If it's not managed well, it affects every part of your daily life. It affects your family relationships, it affects the way you look after yourself, the way you get on with just your general tasks. I'm putting my phone down because it's banging on there and it's annoying me. It must be annoying you as well. Just the regular duties that you do at home that I think so many of us take for granted. Just putting the washing out can become such a big chore. So with almost 1 in 5 Australians over the age of 45 being in chronic pain, it's essential that health professionals can effectively help people with this debilitating issue. We are hearing from GPs that they are seeing more people living with chronic pain, with visits rising 67% over the past 10 years. It's the leading cause of disability, and nearly half of people dealing with it also experience anxiety or depression. So beyond individual suffering, chronic pain costs Australia more than $144 billion a year. That is an extraordinary number, and that's mainly through reduced quality of life and productivity. So we need to help people living with chronic pain to have better lives where they can as much as possible so they can enjoy the things that they used to do. Despite chronic pain affecting so many Australians, not all healthcare professionals have had the opportunity to learn more about this complex condition. And the Australian Standards for Health Practitioner Pain Management Education, funded by the Australian Government, are the first nationally consistent standards. Our hope is that these will help a broad range of health professionals provide better, more consistent care to people living with pain, provide a valuable guidance tool for delivery of education about therapies and approaches that help pain, and to maximise life. These standards will help strengthen knowledge, improve practice and reduce the burden of pain. It's important, I think, for me to share other ways our government is helping people live and manage their pain through other efforts, including the National Action Plan, a new chronic conditions program, and by funding research. So the National Strategic Action Plan for Pain Management is about providing care for all Australians living with chronic pain. It includes more than $3 million to promote pain management education across health disciplines and for patient education awareness and support. And this, of course, includes funding the Australian New Zealand College of Anaesthetists to develop the standards being launched today. But also for initiatives including Pain Australia to provide education and awareness activities, the University of Sydney, who are developing and providing pain management and training education resources for medical practitioners, and for the National Pain Management Health Practitioner Education Strategy, which was launched in 2023. This plan will bring an Australian-wide approach to pain management education across health disciplines and throughout the health practitioner's career, and will work side by side with the standards that are launched today. And similarly, our new Chronic Conditions Prevention and Integration Care program aims to improve the health of the 15.4 million Australians living with chronic conditions. It's about getting help early and helping people manage their own health to improve life expectancy and quality of life, reducing health costs and supporting the workforce, along with improving productivity. Our government's also very committed to health and medical research, and a medical research future fund chronic pain grant is providing $8.4 million for 10 grants across the country. That includes efforts such as Monash University's research into safer, more effective pain therapies, or Queensland University of Technology's work on medicinal cannabis to improve pain in children receiving palliative care for advanced cancer. And under a medical research future fund initiative, 5 projects totalling $11.3 million will research chronic pain, including lower back and musculoskeletal pain, and optimising pain management. So I hope that gives you some confidence that there's work happening right across the spectrum, whether it's from research to education through to the work that's being launched today with the standards of care to support our workforce, but also to support people living with chronic pain to have access to the best possible care so they can live their best possible life. Congratulations on the work that you've put in to develop these standards. I'm really proud to be here today to help with the launch. Thank you very much for having me.
Thank you very much, Minister. And I think we really appreciate your support. We really appreciate the support for you being here today, but also, as you mentioned, that holistic support that the government's giving for funding, for research, for education, because a couple of times in your speech you mentioned the words quality of life, and I think when it comes to pain, that's what really is impacted is people's quality of life, and that's quite hard to measure. And often with pain, it's quite hidden. People, don't go to work. They may not be able to socialise. So it's really largely remained quite a hidden problem until quite recently, that now we're hearing more about it. We're seeing more coverage in the media. We're seeing more government support. And with the launch of the new standards, it will really transform how health practitioners of all kinds are educated with a very, as you'll hear in our panel discussion, patient-centred approach, a very collaborative approach, which is what patients tell us that they want. And I think these standards are really going to make a huge difference. And now I'm just going to, I'm going to talk for a few minutes because I know they wanted to grab the Minister for a photo. So we might do that now. Jen, if you can just come over to the media wall, would that be okay? Thank you. And we'll just have a couple of photos while I can just tell you a little bit more about these standards. You can see in the slide that's up, in the panel discussion we're going to have, we're going to delve into the standards in a little bit more detail. Some of the things that I really liked about the standards was really the collaboration, because from a patient point of view, this is what patients want. At the moment, people with lived experience, we're having to do that collaboration ourselves and have to manage everything. And communication is another big factor. Having a standard language for pain that everyone is taught, so that if you're going from one practitioner to the other, they're all speaking the same language and you're understanding. When you talk about your experience, they're really hearing you in the same language. The person-centred approach is so important, and also the evidence-based content, because our knowledge of pain, as you're going to hear in our discussion, is always changing, and we're learning more and more. And so we want these standards, these education standards, to reflect that as well. We're also going to talk about the concept of reflective practice, which I think is a really important part as well for practitioners, for them to recognise how they're, how they're going with consultations, what they could have done better as well. And I think when you're dealing with a challenging issue like chronic pain, it can be hard if people don't necessarily get the results they want straight away. So I think that's a really powerful part of the standards as well. And yes, the last part is, as I said, collaboration. So I think if you take the time, and we'll hear in the panel discussion about these standards, but when you read through them, and you can go onto the portal and also watch the great videos that have been shot as well, you get a really good understanding of what a difference these standards are going to make to education in Australia. So I can see that our next speaker has arrived, so enough from me. I think they're just going to get one quick photo of Mike, and then I'm going to introduce him. So we'll just get one quick photo of Mike Freelander, and then we'll get him to come up on stage. And while we do the panel discussion, we're probably not going to have time to take questions from the audience, but all of the panel will be here. So straight after the panel discussion, if you have any questions for the panel, you'll have time to ask them straight after that discussion. So I might introduce, we'll just get one photo of Mike, and then we might introduce him. So I'd now like to introduce Dr. Mike Freelander, MP, to say a few words. Many of you in the health industry will know Mike. He's the chair of the Standing Committee on Health, Aged Care and Disability, and he represents the electorate of Macarthur in New South Wales. So come on up, Mike. Thank you very much.
Thanks very much for having me. I'd like to acknowledge I'm meeting on the lands of the Ngunnawal and Ngambri people and pay my respects to them and any Aboriginal people present here today. I'd like to also acknowledge the Darawal people and the Tharawal Aboriginal Health Centre in my own electorate, with whom I've worked for the last 35 years. And pain management is a real problem in active practice, particularly in our emergency departments, in our general practices, and also in the paediatric world. And I think that many jurisdictions have struggled with pain management for many years. In particular in the United States, they have really been dealing with a narcotic epidemic, I would say. We've also seen the number of deaths from overdoses in Australia increasing, and pain management with an ageing population being an increasing problem in primary practice. I'd really like to thank Rebecca White for her comments. She is a terrific Assistant Health Minister and is dealing with a whole range of issues around women's health, around aged care, which intersect with pain management. I'd also like to thank really the whole concept of dealing with pain management becoming a educational issue for our general practitioners and our primary providers. This Australian standards for health practitioner pain management is a fantastic document, and I am going to recommend that we get as many copies to our primary practices, to our emergency departments, as we possibly can. This is a great initiative by the Faculty of Pain Management, and I congratulate you on it. It's a problem not just in primary care, it's a problem in our hospitals. Paediatric pain management has been a particular issue of mine that hasn't been addressed very well in years past, and it is a problem for paediatricians in general. And whilst it is important to educate our primary practitioners, specialists need also to be educated about pain and pain management. It's a problem in our aged care system, and I've seen that really many of our aged care providers struggle to deal with that in residential aged care. The work that's been done here is fantastic. The Minister has stressed the importance of education, and we are dealing now with a primary care workforce in both our medical practitioners and our nurse practitioners that is really confronted by a whole range of issues in an ageing population. We need to make sure that our primary practitioners are educated about patient care and about pain management, and the Australian New Zealand College of Pain Medicine is a really important player in this field, and this is the first time I've really seen an Australian standards that is implementable and can be provided to all our practitioners. So I congratulate you all on the work that you've done, and really I think the work that has been done here will really add to the care we can provide our patients around the country. So congratulations, and thank you for having me here today. Thanks.
Thank you, Dr. Freelander, and thank you also for recognising that pain is something that affects people of all ages, even children. You can think how tough it must be for a child who has, say, like juvenile arthritis or something like that, who can't even really explain what they're going through, let alone having to manage living with pain every day. So I think that's something to bear in mind, and that's why it's so helpful that these standards will be used for all different health practitioners, including people like paediatricians. So while the project to develop these really important standards was led by the Faculty of Pain Medicine, it really involved significant engagement and consultation with a broad range of stakeholders. And this was really important because they wanted the standards to be used and applied across all health disciplines and at all levels of education and training. So we're now going to hear from several people who are involved and bring important different perspectives to this work. So I'll just read out their bios and you can give them a round of applause. Please welcome back to the stage Dr. Noam Winter. You want to come and have a seat? I'd like to introduce Associate Professor Michael Reynolds. If he can come up, he's a Wiradjuri man, physiotherapist, and he's Deputy Head of the School of Allied Health at the Australian Catholic University, and he's also the Board Chair of the Australian Physiotherapy Council. Kate May is a Health Communications Advisor and Chronic Pain Advocate based in Melbourne, and she draws on her professional and lived experience of pain with her policy and research work. She's a member of the ANZCA Faculty of Pain Medicine Research Committee, a board director, and runs the support groups at Chronic Pain Australia. And last but definitely not least, Dr. Phoebe Holdenson-Kimura. She's a medical advisor at the Commission on Safety and Quality in Healthcare. She's also a GP working in Sydney, in Hornsby, and lectures in the clinical school at the University of Sydney. So welcome to all of our panel. So, Noam, I might start with you. We know that pain management has changed significantly over time. From your perspective as a pain physician yourself, what are the most important shifts in how we now understand and manage both acute and chronic pain?
Thank you. So I think probably in the last couple of decades that I've been in this field, we've seen sort of this massive explosion in our understanding of the biology. Yet I think for a lot of clinicians who are on the front lines, pain is still largely invisible. So we know that to get the best outcomes for our patients, for both acute and persistent pain, you need to treat the patient far more holistically. And I think that's reflected by standard number 1. It's about a person-centred approach. It's about looking at the patient, centering them in the middle of their experience and then learning from that.
And how awesome is it that they put that as the first standard as well? I just think that deserves a round of applause, because from a patient point of view, person-centred care is something that we all want and all deserve. And Phoebe, I might just go to you next. So we know that up to 40% of GP consultations are for chronic pain, but many GPs have limited training in pain management. What impact do you think the standards will make on improving how health practitioners really do treat patients?
Yeah, so I'm very hopeful that it's going to have a really significant impact in the lives of, as we heard, the many people in Australia living with chronic pain. I guess, as you said, a lot of Australians who are experiencing acute pain perhaps might present first time to see their GP to try and understand what's going on. And I think with the broad adoption of these standards in the education space, what we'll see over time is that GPs are, better equipped to do a really comprehensive assessment, potentially do less imaging or prioritise those non-medication or non-pharmacological approaches, but really set that patient on the right path forward, so that over time we will see that there's fewer patients going on to develop chronic pain, because I think that very first interaction or those first few weeks or months are really critical in terms of those people's journeys. And I think what I really like about these standards in that respect is that it's not just talking about education in terms of book knowledge, it's very practical knowledge that we're talking about. And so I think over time what we'll be able to see is that people won't necessarily just know about the science or the biology of pain, but also be equipped with the language to be able to talk to patients about, look, you've come today with back pain. From the history and examination today, I'm confident that there's nothing sinister going on, that your back isn't damaged, but your system's sensitised. And what that means is that your brain is amplifying signals, and that things like stress or like worries can actually make that pain feel worse. And that's why we've got to look at the whole picture here. And so then we're going to really be partnering with people as they go through those next few weeks.
Amazing. And I might just go to Kate next. Can you just share with the audience, how long did it take you to get a proper diagnosis, and what impact did those delays have on you?
Yeah, so it's definitely a long story, and I'll take you back to what was 10 years ago for me, and a 20-year-old Kate, student living abroad, had my first internship, and I had my whole life ahead of me. And I first started getting this persistent abdominal and lower back pain, and I'd had an infection, but it had resolved. All my test results were looking fine, but I was getting worse and worse. And it got bad enough that I came back to Australia for good, because I needed some support. I needed some answers, and I needed to get better. I was sort of told at the time when I went to emergency, I went to my primary care, I went to physios, I was sort of told, everything's looking good, it's normal, it'll probably get better. Maybe it's stress, maybe it's something menstrual, nothing we can sort of do, it'll probably resolve. If I fast forward about another 6 years, and you can fill in some of the gaps there, because I hadn't gotten better. In fact, I'd gotten a lot worse. And it wasn't just abdominal pain, it wasn't just back pain by then. It had become whole body pain, what's known as widespread pain. It was my back, it was my head, it was my feet. I don't know, everything got involved. And I learned, and I know now that's what can happen if you don't get the treatment and care. Life was pretty rough. It felt like my body was on fire from the inside out, and nothing was extinguishing those flames, no matter how hard I tried. But good news, there is a turning point in my story, and that was for me. I, by chance, went to see a new physio just for some neck problems. They saw me a few times and they sat me down and they said, Kate, this is not normal. It's not normal for a 20-something-year-old to be experiencing this. It's not normal for you not to be responding to the treatments that we're giving. I can't help you, but there are people that can. This is a chronic pain thing, and he started off that referral process to get me some care. And look, it took another year from there to actually get some specific diagnoses to what was going on and to respond to treatment. But ultimately I did respond really well to treatment, and 3 years on from that, 10 years on from the first experience of pain, I'm now, living a relatively normal life. I'm managing. I probably live with about 80%, 90% less pain than I did in those worst days. And that's pretty special. But you ask about what I lost. I lost my 20s. That was it. I lost a lot of what made me me. I lost a lot of my confidence. I lost a lot of my hobbies. And I'm doing my best to get some of that back, but it's still ongoing. And I think what's so important for me and what I've really learned throughout this journey is this is not an isolated story. It's a huge public health problem that is so deeply unseen. And that's why this kind of work is so important.
So I'll just stay with you, Kate, for a second. So when you got that, when that physio really helped you see that there was a different path, what were your emotions at that point? Getting the sense that there was another path that you could potentially go down.
Honestly, I didn't really believe it. I'd been told so many different things. I'd had different diagnoses. I'd been dismissed. I'd thought this new treatment would work, that I was like, okay, that's just another thing. I actually remember I eventually was diagnosed with chronic migraine, and I live with a few neurological conditions. And when I started taking medication and started some different treatment, I responded straight away. And I was just in disbelief. I was like, that's not a thing. That's, it's just going to get worse again. That's fine. Don't get your hopes up. It really took months of that for me to actually start to get that relief, I guess, or think maybe this is actually going to be okay.
And before we move on, you shared a quote about the longer you have chronic pain, the better your nervous system gets at making it. Can you just explain what you meant by that to the audience?
I mean, your body, your brain, your nervous system is really good at dialing up pain. Once it kind of gets going, it learns those pathways. And particularly when it goes unresolved. So for so long, my pain was either seen as something acute that would pass or something else. Maybe it's not a thing at all. Perhaps it's in the too hard basket. And when those delays happen, your body amplifies. And again, I explained that my pain started off as abdominal and lower back. That's not where it was by the end of it. It took on a life of its own. And unfortunately, that is what happens when you don't get access to the care you need. It doesn't just get better. And you end up back in the medical system in many sorts of ways, often in acute and emergency settings. And
that goes to what Phoebe was saying about the importance of getting that early, correct diagnosis. So Michael Reynolds, the process for these standards was very collaborative. Why was that so important, and how do you think that really improves and strengthens the standards, the fact that so many different groups were involved?
I remember getting invited to this group, not really understand. As an Aboriginal person, you get asked to lots of different advisory committees, and to be honest, sometimes it's a little tokenistic, and you become a bit tired of it. And when I was invited to this, I wasn't sure what to expect, but it really only took one meeting, and with a great leadership through the Faculty of Pain Medicine, everyone involved with it, to make me feel welcomed, and not only me feel welcomed, but the people around the room feeling welcomed. Consumers, multicultural, people representing culturally and linguistically diverse communities, and across professions as well. This was a truly multidisciplinary, multicultural, multi-experienced approach, which you couldn't not feel welcomed into and felt like you wanted to contribute even further. The impact of that is that it's self-evident. You can look in the standards now that this does speak to, I think, all Australians. I think it does speak to all educators. It speaks to all clinicians as a better way forwards for treating pain. Being an academic, I know that there is a long way to go in our higher education system. There is a long way to go in our current workforce to actually meet these standards, but I'm so encouraged by the approach that was taken in these standards that the implementation phase, if it's done in the same spirit, it'll do very well.
Thank you. And Noam, what difference do you think these standards will make for the quality of care, given that as you know, a lot of health practitioners might have finished their training before we've had this new understanding of the difference between acute and chronic pain?
So I think, as was just reflected, is that and it's been said multiple times a day, people interact with the health system at lots of different points. And it's about just trying to get everyone to have the same approach, same common language, same common framework in how we deal with things. And when it comes to, I guess, the implementation part of this, like, yes, probably from an undergraduate perspective and training level, that's something that we're going to need to focus on. But we also need to focus on the experienced clinicians out there already. Yes. And it's about how we get to the clinicians that have been practicing for 40 years and making them change their framework and their language and their approach to things as well. So part of it as well is going to be, yes, implementing from a undergraduate perspective, but also implementing from a continuing professional development perspective as well.
And look, one of the themes we've heard quite a bit today is communication and how important good communication is. So Kate, I might, given that you and I are both in the communication space, we know that many people in pain will turn to, well, Dr. Google, but they're probably turning to AI now for help. So why is it so important that we have good communication to filter out, poor or misinformation?
Yeah, I mean, it's tough being a communicator and even a health communicator, because pain is really tricky to communicate and it's really tricky to understand. And I think it's so important to have standards and have places you can go to, because the alternative and the harms that can happen when you don't have support, when you don't have access to information, are really, catastrophic. I'd love to reflect. I've run just a small local support group over the last few years, and we just go grab a coffee once a month and have a yarn about pain in our lives and what's going on. And one thing I see every single time is folks coming in and they're really angry. They're really let down. They feel like they've been burnt by their experiences in healthcare, and they've lost a lot of trust. Many don't want to go to the doctor again. Many don't trust research. Many don't trust governments. Many feel very alone and isolated. And what happens when you're unwell and you don't feel like you can trust someone to go and ask for help? You go online, you self-medicate, you Google till you just keep going, and there's a lot of really harmful stuff online. Not only is there misinformation, there's a lot of companies trying to sell you things that will fix your pain, get to the root cause. I mean, I've bought some of that stuff before and it's really just landfill, some of it.
Well, I know Kate and I last night were talking about all the things that we have both tried for migraine, and we look back and you think, you're desperate, and you think you'll try anything, thinking it'll make a difference.
And it's so important to me to be rebuilding trust with the community and making sure that when we do go in and ask for help, it doesn't take 7 years of relentless trying to get something that works, because there are amazing things out there that do work. There are practitioners that really care. There are great services, but you've got to get to them and you've got to not burn yourself in the process. Because the alternative, the stuff that you can get online, the alternative health that sometimes some of it can be kind of sketchy, and the self-medication is a huge one as well. The harms it can create when you don't have that access are just catastrophic, and it's something I'm just increasingly concerned about.
So Michael, I might ask you, can you share how cultural safety has been embedded into these standards? Because we heard at the start of today's event that the rates of pain in our Indigenous people are even higher. So how have we made sure to include cultural safety so that First Nations people with pain can get the care in a culturally appropriate way?
With cultural safety, it's important to recognise that cultural safety is determined by the people receiving their care, by their families and communities. So I see this when I speak with lecturers who are educating, to clinicians. How do I know that I'm being culturally safe? And there's often this paralysis to act, to actually be culturally informed, to say the right things, to do the right things, to not cause offence. Because people at their heart, particularly health professionals have good hearts. And so cultural safety is this thing that people, they want to be and they think they are, but they're not quite sure that they are, because it's determined by the people receiving their care. So there's a step from being a little uncomfortable in that space to becoming culturally safe. That starts with a sense of humility, a mindset that you don't know it all, despite your fantastic training through the education system, throughout all your years of knowledge as a doctor, as a nurse, as a physio. You don't know everything. You need to know the person sitting in front of you, which is why I'm also so pleased to see that a person-centred approach is number one on these standards. Because putting the person in front of you first actually is your first really important step towards cultural safety. And our challenge, I think, for practitioners is to moving away from this awareness that I need to be culturally informed or culturally aware to actually doing something about it, and actually for practitioners to feel empowered to do something about that, and put the patient first, and put the person first, put their families first, put their communities first, and take the time to actually understand what is unique in this person's presentation. And you can see those values aren't unique to Aboriginal and Torres Strait Islander people, though often the healthcare system actually falls short so many more times for Aboriginal and Torres Strait Islander people. This is common to a lot of people that come and seek our care, including all the stories that you've no doubt seen as well with the support group that you spoke of, where people are just frustrated. And no one, I think, maybe even so frustrated. Well, the Aboriginal and Torres Strait Islander communities are terribly frustrated in this space, because not only are they disproportionately affected by chronic pain, but often they don't have access to affordable and appropriate care, and the appropriate care being culturally safe care. So these principles outlined in these standards go a long way towards culturally safe care. And what's important as they're implemented to see if we are being successful in cultural safety, that we're asking Aboriginal and Torres Strait Islander communities, asking Aboriginal and Torres Strait Islander patients as a discrete group to make sure that we're doing the right thing by them.
Thank you, Michael. So we've only got a couple of minutes left, so I wanted to just ask each of our amazing panel what they would say, what's the one key message that they want all of this, everyone of the lovely audience members to take away. The one key thing that you want the audience to be going back to wherever they go into next, to be thinking about and to be talking and telling someone about. So maybe I'll start with Noam. What's the key thing that you want our lovely audience to take away and to tell other people?
So I think what we've heard today multiple times, multiple testimonials, is that for the vast majority of Australians living with chronic pain, they've largely been suffering in silence. They're suffering unseen. And I think today is a day of reckoning for them to step forward, for us to see them, and then to start the process of trying to treat them with the dignity and respect they deserve.
Amazing. And Michael, from you?
Too many times we have pieces of paper and standards that are produced and not having great implementation. I can't see this failing at all. I see this really having a massive impact because the size of the problem is so big. The hard thing about this isn't so much the size of the problem, it's the amount of people that we need to bring around the table to actually solve it. This is a cross-sector initiative to implement this across education, across healthcare sectors, across professions, where we actually need to put our differences aside, bring the best parts of our differences forwards so we can properly collaborate together. And I think in doing that, always making sure that the people experiencing that pain are always put first.
Thank you. And Kate?
Yeah, I think what's so important to me is I hope that you can all see the benefits that happen when we invest in pain, and to keep the momentum going. Invest in pain because the benefits that we get collectively are too great. It's not only the money that we save from early intervention and the system waste, it's quality of life, it's reduced suffering, it's saved lives. I wouldn't be here without the care that I eventually got, but I'm still piecing together some of those years of suffering, and I think this stuff works, so please keep investing in this work.
And lastly, Phoebe?
Thank you. So I think that when it comes to education, we often think about universities, colleges, big bodies that are responsible for writing curriculum, and obviously these standards are going to have an enormous impact at that level. But I guess my challenge is that all clinicians actually are educators, in my view. We're teaching our patients, but also we have junior staff around us, we have colleagues, we have students who are sitting in with us. And so I think the big challenge is for these to be implemented at that institutional higher level, but also for clinicians to have a look at the standards and go, I wonder how I'm going here. And that's when it comes to that reflective practitioner standard there, is that, pain consultations, when they're done well, are beautiful, and you can actually see a sense of relief on the person's face as they walk out of the room, and you get a sense that, yeah, things are going to be different going forward. But equally, some of my most challenging consultations in my career so far have related to pain. And so I think actually creating the space and also building the skills to be able to reflect on that, reflecting on your own beliefs and attitudes towards pain, and thinking about how that relates to your day-to-day practice with patients, I think is my big challenge. Because if we all do that across the board, then as Kate was saying, it's not just about finding the right service or the right clinician. It means that the whole of the healthcare system will be speaking the same language and providing the right care.
Amazing. So please give our panel a big round of applause. Thank you so much. And I guess my call to action for you in the audience is to really take this message and amplify it. So talk to people about what you've heard today, and we'd love you to post on social media about this event, about these new education standards, because the more we can get the message out and the more these standards are used, the better the outcomes for patients are going to be. We want this to be a living, breathing document, not just something that's put on the shelf. And now this brings us to the formal end of today's proceedings, and it's been a really great event. I hope you leave here with a much better understanding of these standards and the impact they're going to make. I'm certainly going to look forward to seeing how they're taken up by important bodies across Australia and New Zealand. And on behalf of the Faculty of Pain Medicine, we'd love you to stay and have some lunch. There's lunch at the back. And we also have copies of the standards as well. So we'd love you to take the standards and the national strategy to have a deeper look at what we've been talking about today. And we've got also the staff, the faculty of, come on over here so they can see who you are. Come on over. Give them a round of applause for today's event and putting on a great event. So if you have any deeper questions, these are our experts, so please come and see them. Thank you so much for being here, and again, we really value your time. Thank you so much.